Back with programming. Up next, a discussion formatted session titled Long COVID in Children and Young People. Now, this has been a topic asked about for the last day and a half in the chat, specifically asking about children. Now, when this session is over, you'll be able to better understand how long COVID and disability is experienced in children and young people, and better understand how rehabilitation can safely support children and young people living with long COVID. Let's bring out our session chair, Dr. Jennifer Audette.
Hi, everyone. Welcome to this session on long COVID in children and young people. We're happy to have you with us today, and we have a great panel of speakers for you to learn from. I live in the United States. I'm a faculty member at a university here, and I'm moderating the session, and we'll introduce the panelists in just a moment. We wanted to start by sort of making the comment that some people believe that kids can't get long COVID. And the panelists for this session are here to dispel that myth, because children can and do get long COVID. And they know this because some of them are parents of children with long COVID, people who work with children with long COVID, and some of our panelists have long COVID themselves. So they're able to address the topic from those two perspectives, which is really wonderful. I have had an amazing time working with them, preparing for this session and learning more about this topic myself. Let's see. I think we're going to jump right into our questions. The panelists' bios are on the website, and I guess I'll just have you each say a little word of introduction when we have you make your first comments, if that's okay, just in the interest of time. So Dr. Bertino this morning and some of the panelists yesterday, oh yes, we're missing a person. Bertini is here. Can we give her access? Sorry, Binita. I said the wrong name. Hi, Binita. Hi. And is Kirsty on? Yes, I see Kirsty now. You weren't. Okay. Hi. Okay, so let's start with the first question. Dr. Bertino described some of the various long COVID symptoms, and other sessions people have also voiced all the ways in which long COVID is manifesting itself. But what we'd like you to talk about first is that how is long COVID manifesting in children and young people? And let's start with Eleni.
Hi, my name is Eleni Iasonidou, and I'm a person living with long COVID myself. I'm president and co-founder of Long COVID Greece, and I'm the lead representative of long COVID kids in Greece. Well, when it comes to symptoms, we know that long COVID has over 200 symptoms. In young people, mainly it's manifesting with symptoms of fatigue, headache, tachycardia, brain fog, orthostatic intolerance, and mood swings. The older the age, the symptoms are more like adult type. The younger the age, symptoms are more non-specific, like belly aches, losing weight due to poor appetite or altered smell or taste, not failing school and not playing as much as before, coughs, colds. Younger children cannot articulate their needs. They use indirect means of communication, and they tend to adjust very quickly. So it's up to the caregiver to pick up the differences, and for that you need very sensitive antennas, knowledge to identify, and bravery to accept and validate the symptoms. In my experience as a doctor as well, socioeconomic and educational status of the family plays an important role when it comes to recognition, plus a child's academic or athletic background. So in young people who are high achievers, it's easier to spot the difference, as opposed to children, for example, with lower socioeconomic status, where symptoms can get lost and unattended, and children can be left alone on their own to struggle.
Thanks, Eleni. Kirsty, would you address the same question?
Yes, of course. Yeah. So my name's Kirsty Stanley. I'm an occupational therapist. I work with long COVID kids, and I have long COVID myself. And I'm one of the co-founders of occupational therapy for long COVID. So what I want to add to this question is around kind of acknowledging complications that we may have other names for that come along with COVID infection, such as a pediatric inflammatory multisystem syndrome, which is suspected as an autoimmune response and happens, a couple of weeks after initial infection. And then pediatric acute neuropsychiatric symptom, or PANS. And I particularly want to focus on this condition because of its initiation of mental health challenges and the fact that for treatment in some countries for this is actually administration of antibiotics and anti-inflammatories, including sort of sometimes steroids and IVG treatments. So if children and young people are experiencing new or sudden onset of depression, anxiety, any regression in their development, OCD, eating disorders or psychosis, we need to consider this because the evidence is that early intervention is identified as having better outcomes. And then additionally, some children have been diagnosed with other already recognised conditions such as myalgic encephalomyelitis, chronic fatigue syndrome, postural orthostatic tachycardia syndrome, and other dysautonomias, mast cell activation syndrome, and functional neurological disorder. So it's always worth keeping an open mind to the possibility of these common comorbidities because they can be managed along with individual symptoms.
Thank you, Kirsty. Sammie, do you have something to add?
Hi, thank you. My name is Sammie Mcfarland. I'm the CEO and founder of Long COVID Kids. I'm a mother of a child with long COVID who's been experiencing symptoms since March 2020, and I'm also a person living with long COVID. So just to build really on what Eleni and Kirsty have said, I think it's important to mention that we see a lot of rashes in children that can come and go. We see new food intolerances, nerve pain, extreme nausea, a loss of mobility due to extreme fatigue and or pain. We also see in younger children that their symptoms can present in regressions and things like refusing to walk, reverting to bum shuffling or crawling, and missing milestones. So families widely report changes in hearing and more often auditory sensitivity, but also the inability to tolerate loud noises without other auditory challenges. We see deterioration in sight. So we're getting increasing reports of children needing multiple changes to their prescriptions or new prescriptions in a very short space of time. And these are being monitored by their opticians. And we also see seizures and fainting in young people who didn't have these symptoms before and have not yet been given any other diagnosis. So it's a really wide range of symptoms. And really, we always say, think any new symptom after a COVID infection could be long COVID. Thank you.
Thanks, Sammie. Some conversation has been happening during the conference about chronic illness and similarities and differences between long COVID. And it's been discussed a bit, but I'd like to hear your perspective on how similar or different long COVID in children is from other chronic diseases. And we'll start with Cara, please.
Hi. So my name is Cara Kaup. I am a person living with long COVID. I'm a part of the long COVID Physio executive as a peer support co-director. I'm not well enough to work right now, but I am a pediatric physiotherapist, and I feel very strongly about kids and want to advocate for them. So I think we've heard loud and clear through a number of the sessions that long COVID definitely is similar to some chronic illnesses, especially the ME/CFS community, but also others. I think one of the biggest things that we need to learn about, if you haven't heard already from yesterday's presentations and today as well, is we really need to learn about post-exertional malaise or post-exertional symptom exacerbation. That is a hallmark symptom of ME/CFS. And I'm hearing various statistics out there. I was emailing Todd last night to make sure I had the right statistic, but over 50 to 75% of us, including myself, have been diagnosed with ME/CFS. And that is similar for children as well, I think. So we need to learn from that community, because there's many similar principles that they have applied for the last 20 to I'm not sure how many years, because it was new to me, about how to handle this new chronic illness. We start feeling better, we want to do more, and then we crash and we go through this boom-bust cycle. But in children, this post-exertional symptom exacerbation can present with cognitive demands such as school, physical activities, playing with their friends in the playground, doing gym at school, doing extracurricular activities or sports, or having extreme emotion, whether it's happy, sad, mad. And as Eleni said, children can't voice how they're feeling, so we really need to watch their behaviors and how they're acting and learn to ask for specific questions, like they were saying in the rehab session yesterday, that know what to ask them because they may not be able to see it themselves. And we need to help the parents and the teenagers to educate their teachers and their coaches, or their brownie leaders, how to look for this and help them with that. And we need to teach these kids how to stop, rest, and pace in their language and at their developmental level. Pacing is hard, really hard, I can say from personal experience as an adult, but even harder for kids because they don't necessarily understand. So we have to speak in their language. Thank you.
Thank you, Cara. Alison, what do you have to add?
Okay, well, I'm Alison Twycrosss. I'm a former Deputy Dean and Professor of Children's Nursing. I'm the founding chair of Long COVID Nurses and Midwives UK, and I am also living with long COVID. And I'd like to touch on the social implications of long COVID. And in doing so, I'm going to draw on the research from the chronic pain world, partly because pediatric pain management is one of my specialist areas, but also because there's currently no real research focusing on long COVID in kids in this context. Although we know there's lots of anecdotal evidence as highlighted by groups such as Long COVID Kids. So what do we know about the impact of chronic pain? We know it impacts on school attendance. We know it impacts on your ability to take part in social activities and to develop peer relationships. We know that disability related to chronic pain is also likely to mean that children and young people are over dependent on their parents, which is a particular issue during adolescence when young people would normally be becoming more independent. A recent study of nearly 15,000 young adults with chronic pain in the USA found they were at risk of reduced educational attainment, poor vocational attainment, and early parenthood. Peer relationships are an important aspect of normal development, and having a chronic illness or disability impacts on this. And there's no doubt in my mind that children with long COVID are also at risk in relation to social attainment because of all that long COVID brings. And actually a lack of awareness about long COVID in children and young people in the general population and in educational establishments is likely to mean that the impact of long COVID is greater than other chronic illnesses and disabilities. And I think for children and young people, this is particularly an issue because they have very little control over what they do. So, for example, they have very little control over saying, I really only don't want to go to school today, or I'll go to school, but only for one lesson. And there's lots of reports as school terms start of children with long COVID being forced to do PE, despite having post-exertional symptom exacerbation and malaise. Again, we need to, as Cara mentioned this, we need to make sure we listen to what children and young people with long COVID are saying, particularly in relation to post-exertional symptom exacerbation and malaise, which will be different for all individuals. And I think we have to acknowledge these issues now and begin to address them. Otherwise, we're doing a huge misservice to children and young people with long COVID. And the consequences of not doing something could impact them for years and years to come. Thank you.
Thanks so much, Alison. Eleni, I know you have some comments to add to this question.
Jennifer, well, long COVID shares common features with other chronic illnesses, but is unique in many ways. For example, for the first time in human history, we have so many people getting infected at the same time and developing long-term symptoms. This is already a huge burden for health systems and economies. WHO is estimating 144 million people are living with long COVID worldwide. It's a new disease. We don't know who and why will develop long COVID and for how long. We don't know the implications of reinfections. It was supposed to be a respiratory virus threatening older people with underlying conditions, but now we know that COVID is a multi-system disease affecting us all, regardless of age and overall health condition. We don't know the future implications of the disease. Even in uncomplicated cases, there are recent evidence of increased cardiovascular disorders and strokes 12 months post-COVID. Policymakers and medical societies are just learning to recognize its existence, and unfortunately, in many countries like mine, still is not yet legitimatized. There is no ICD for long COVID or post-COVID condition in Greece.
Thanks, Eleni. Kirsty.
Yeah, so as Alison kind of said, the sort of risk of doing nothing is not great. So we need to embrace the similarities with and learn from other people experiencing chronic health conditions. You know, that they are the experts in their condition, as are people with long COVID. So it's about accepting that our approaches will need to be flexible and adaptable. So as we know more, we do better. But we do have ideas in our toolbox for interventions, and this is why sort of rehabilitation approaches, so for physio, occupational therapy, speech and language therapy, dietitians, etc., are really necessary alongside medical treatments in order to support people to live with and recover from the effects of the virus. We also need to encourage researchers to include people with other chronic illnesses in their long COVID research and build on the research that's already been done in these other areas and perhaps hasn't been as widely disseminated. And not reinventing the wheel when it comes to that. So, for example, we know what doesn't work for people with ME/CFS, and it has been quite discouraging to see the same treatments that have been shown to be ineffective being explored, with it being a potential risk for people, children and young people with long COVID as a result. So we want to turn the very negative effect of the pandemic into a positive that improves care and treatment for all people with chronic illnesses as much as possible.
Thanks so much, Kirsty. I'm going to move on to our next question. Is in terms of long COVID in young people and children, what are the best medical treatments or rehab interventions to minimize the effects? And we'll start with Alison. Back to you.
Thank you. So as a nurse educator, I always promoted a biopsychosocial model of care for all patient groups. And the care required for children and young people with long COVID is no different. Indeed, the guidance from both NHS England and Alberta Health, which can be seen on the Padlet board associated with this session, both recommend a multidisciplinary approach to caring for children and young people with long COVID. What this means in practice is that as well as medical interventions, so diagnostic tests and treatments that we're all crying out for, children and young people with long COVID also need interventions from other healthcare professionals, such as physios, occupational therapists, and psychologists. It's important to note, though, that currently the care available depends on where you live. Even within one country, there may be huge variations in the care provided. And in some parts of the world, there's no care provision at all. So we need a biopsychosocial model of care, but we need care per se. Thank you very much.
Thanks. Sarah-Jayne, we'd love to hear from you on this topic.
Hi, so I'm Sarah-Jayne Walker, and I'm the director at Naomi's Garden, who runs conductive education sessions in very rural Lincolnshire. And I've been doing sessions for children with long COVID, but I don't have long COVID myself. I've got some hands-on experience with these kids. So just around this subject, really, I guess the first point I just wanted to make was the importance, as we're all talking about, was just to all really work together, open communication with one another, explaining to each other what is really working, what isn't. So we can just have this almost open door policy when these children come in, that we can just really share, so we can figure out together what is the best way forward for their treatment and for their rehab too. And I think also just being humble as professionals for the sake of a generation of children with long COVID, just going, hey, this, do you know what, this bit didn't work, or do you know what, this bit did, and just being humble enough just to listen to each other and just to work together is really, really important. So specifically what I do, like I said, is I work in conductive education, which works really beautifully with physio and occupational therapists and other professionals too. And I guess I've been focusing on kind of neuroplasticity and teaching children how to move. So breaking down the movement. So not just expecting the child to learn to stand up again or learning to walk, remain to be again, but really breaking down the movement. What is necessary? What is your body feeling like? Are your toes forward? All those kind of things, really making them feel at one with their body. And also, like, one of the amazing tools that I found is for them to refine their voices, and understanding that their voice is a really powerful thing to help initiate movement. And I found that is a really good way of helping combat fatigue when moving. It really just gives them an extra oomph. So I would recommend that as a tool going forward as well. But also just remembering all small steps count. Whatever the progress looks like that day, it counts. It doesn't matter how small the progress is. And we know that small successes create motivation to continue on the journey towards progression. And we need to know and remember that progression for a child with long COVID is never going to be a straight line. It's going to be up and down, and we have to adapt our practice to ensure that we look at them as they come in through the door that day and go, oh, that's a bad day, or oh, that's a good day. And we just adapt whatever we're doing to see what is happening in that room that day, because we don't know what their day had looked like before they come into our room. So just really, really making sure the child feels heard, and we've taken a moment to really understand how they're feeling that day. And if we need to go back to the drawing board, that's what we do. Thank you.
Thanks, Sarah-Jayne. I love that you focused on how important the team approach is with children. Sammie, what do you think about treatment and rehab intervention with children?
Thanks. So as Sarah-Jayne was saying, to listen to the child and help them understand their body, I think that's really, really huge. There's been a lot of minimising of long COVID in children, which has caused doubt in the child's mind about what they can and can't do, or what is or isn't happening. And I think we really have to enforce how important it is to listen and to help the child understand their body. So at Long COVID Kids, while we're waiting for biomedical research, one of the principles that we have advocated for since 2020 is a precautionary approach to recovery. So we recommend giving children time to convalesce. Don't rush them back. Really important not to push through. I know it's frustrating and it can be disappointing, but we see it time and time again. The children that try to push through for whatever reason often doesn't work out, and it can be actually detrimental to their health. We recommend that children are allowed to sleep during the day, as long as it's not impacting their sleep at night. We see that that's really beneficial. And also, particularly so in the first few months after infection. And this is really, really relevant for children who find that their symptoms worsen on exertion. We recognise that there may be an ongoing need to pace activity for a longer period, and many children through our support services have actually been pacing now for 2.5 years. And I think we really have to hear that 2.5 years of altered living, and recognise that children are going to need support to manage that. It can take time to learn to pace, as was mentioned earlier. And we have 2 resources which are on the Padlet for this presentation, a Cautious Tortoise poster and our Pacing Penguins. And they're both designed for families, but they work for adults as well. Some symptoms can be managed, and it's important to recognise that. Families in our support services share information and tips all the time about ways that they're finding to improve daily life. It might be histamines for some, antihistamines for some children. It could be electrolytes. It could be a combination of treatment protocols. So it's really important we recognise that this is important for each individual. So we're not looking at this and applying a blanket approach, like Sarah-Jayne mentioned. It's got to be individual and with medical advice. So early intervention can improve health and learning outcomes for children and young people, but it's really key that families get the information early on and that set off on a good path. And if we top load healthcare and education support, it's likely to reduce longer term need. Thanks.
Binita, can I ask you to chime in next?
Yeah, I mean, I'm Dr. Binita Kane. I'm a respiratory physician in Manchester for adults, but I actually have a child who has suffered with long COVID for 18 months, and it's taken me on a I would say an international quest for answers, and has led to me becoming a researcher, a long COVID kids advocate, and a bit of a champion for the charity as well. So working closely with Sammie and the gang. My view is that we really need to change the narrative around long COVID in children. I think because tests often come back normal, it's being seen as not a biomedical issue by many doctors and healthcare professionals. But I think we have to get the message out there. If tests are normal, that does not mean there's no pathology. It means we're not doing the right tests. And I think there's increasing evidence from the adult research. This is a vascular disease. That's why every single organ in the body is affected. And what we are sadly going to discover, I think, is that every infection, whether you recover from it or not, is going to cause some damage to those blood vessels. And my concern is this going to be like diabetes for the blood vessels or smoking? So it's not going to impact now, but in 10, 20 years' time, are our kids going to start having strokes and heart attacks in their 20s and 30s and 40s? And we also know that there's been a lot of talk about post-exertional malaise, and we know that's likely to be hypoxia of the tissues. In other words, an inability of the muscles to actually get adequate oxygen into them, either because of the little powerhouses in the cells that don't work, or it could be because of the blood vessel disease that we're starting to understand. And we do actually know a lot about the probable underlying mechanisms. There's decades of research in ME/CFS. There's now over 250,000 papers on COVID. But what's happened is that has not translated into serious research effort or trials of treatment in adults, let alone children. So we're sitting on this mountain of information, but there doesn't seem to be that will from our governments and bodies to actually really push this and invest massive amounts in it. And it's our future generation. So that really needs to change. I would also say that doctors need to treat the treatable. So this has been talked about, but there are many safe treatments that can and should be trialed in clinical practice, obviously with risk-benefit discussions, but they aren't. So simple things like melatonin, antihistamines, potentially beta blockers for POTS, that can really help children's symptoms. And just from my personal perspective, she's now, my daughter has now been on treatment for 6 months. I don't have time to go into it, but she's much, much better. So all of these other things are really important, but it has to also be with the medical treatment alongside.
Thanks so much, Binita, for that perspective. Cara, did you want to add a few words?
I'll just add on, as previous speakers have said, I think validating the child's symptoms or their diagnosis is really important, because not everybody will have access to a COVID test or may have had a false negative test. And I think the primary goal of rehabilitation should be symptom stabilization. And it's really important, I think, for those of us that used to work differently to change our focus as therapists and look at that symptom stabilization first. We need to be screening for that post-exertional symptom exacerbation. You can see I'm pumping my electrolytes right now and my beta blockers finally kicking in. But I definitely had a whopping headache last night and felt like I had two boots on my chest with, chest tightness. And those are my sort of primary symptoms when my symptoms get exacerbated. And it's really important to learn about POTS. And there's a session later today that I'll go in great detail, I hope. But the one thing that's different with kids when you're looking at how they change from lying down to standing it's a change of greater than 40 beats per minute versus 30 beats per minute with kids. So I'm not sure if that group will be covering that or not. It's really important to discuss helpful aids with the kids and their families. Like a shower chair made a huge difference for me, even though it was hard to accept that I needed one. Getting, a pill dose set that holds all the different medication, because it's really hard to keep track of whether you took them or not, and make it easier for the parents to keep track of that as well. Keeping a diary of the symptoms that occur and what triggers them and what helps them is super helpful. Or even renting a wheelchair if you need for longer distances, or some people need a wheelchair to get around all the time. Again, as I said before, really helping the family to educate the teachers and the coaches and the, extracurricular leaders about resting and pacing and how to gradually increase activity. And we need to do this in their schoolwork life, in gym, in sports. And another big thing is socialization is a really big thing for kids, and their friendships will change because they won't have the physical or the cognitive ability to participate like they did before. So trying to adapt and help them so that they can still participate in some form with their friends. And again, just remembering it right now, there is no cure for long COVID. So we really need to support the children and their families how to live with this new disability and illness. Thank you.
Thanks, Cara. Any final comments, Eleni, on this question?
Unfortunately, for the time being, there are no proven targeted treatments for long COVID, although science is working on it. But we need to make sure that we are treating conditions like pericarditis, pulmonary embolism, POTS, asthma, allergies, diabetes, thyroiditis, and other manifestations originating from initial COVID infection. We need to make sure that rehabilitation is accessible to all, not as a cure, but as a means of learning to live with our disabilities. For example, a child with POTS needs to make life adjustments like avoiding prolonged standing, exercise supine or seated, avoid sports like running or aerial dancing. I had a girl who was doing aerial dancing. Children with exercise intolerance or post-exertion malaise need to be very cautious and avoid, for example, graded exercise. Children with fatigue need to learn to conserve energy, break down activities, and have frequent breaks. Young people with cognitive deficits will need support with reading and sensory overload. And those are just a few examples as to how complicated things can become and how many new things we need to be learning while living with long COVID. So what I usually say to parents is, trust your child, listen to your child. This is very important. Teachers are pushing kids to do things more than they can. Many doctors are minimizing symptoms. So we need to listen to the child. We need to validate, and we need to trust them.
Thanks so much, Eleni. I think the last question we probably have time for is related to mental health. And some of you have alluded to this issue already, but in particular, what are some special considerations related to the mental health of children and their parents in relation to long COVID? And Sarah-Jayne, we'll start with you.
Yeah, I actually believe that this is one of the main issues or the most worrying issues for children and parents who are struggling with long COVID. We have children who, before COVID hit, were neurotypical. They were just functioning as they should, or how society tells them they should function. They're in education, and now suddenly everything has been stripped away from them, and they're having to get used to a new kind of normal. We don't know how long that normal is going to be what it is. But they've just lost such a sense of identity. They were a friend, they were a student, and it's all kind of just disappeared in a couple of months, maybe less sometimes. And I feel like that has to be noted and counted, and they have to be heard, because many of them, we focus, unfortunately, as professionals, of how much pain are you in? How's your fatigue? When actually we should be going, how are you. How are you feeling today? Are you happy? Are you sad? Is it a bad day? Is it a good day? What are you feeling right now in this moment, and how can we help you? Because I just think the more that we can do that, the more safe they're going to feel. And the safer they feel, the more progress is potentially able to happen, because they just let down those walls. And as you feel safe, we know that cortisol levels should start to go down as well. So that's really, really important to ask our kids, hey, how are you doing, mate? You doing all right? And then going with that. And it's the same with parents. I mean, I've worked with parents with different conditions all the way through pandemic, whether it's cerebral palsy or primary carers with MS or Parkinson's. And what we have is we have a group of parents who are burnt out after the pandemic because they've been unsupported. And for those children who haven't got long COVID, so we're looking at, cerebral palsy or something, they might have gone back to school and they might be seeing their other, like the physios and things, or like parents have now gone back into work so they can recharge at work. But actually these parents who have children with long COVID, they are completely burnt out and they are exhausted because they're having to fight on every single level, whether it be in their education system or it'll be with their family to try and get them to understand that their child isn't just being lazy or isn't being unsociable, but actually it's a real issue they have and you need to try and understand. So I think we as professionals and as groups like long COVID kids, we just need to make sure that those around us with long COVID are actually okay, and that we signpost those who need to be signposted to services, and just check in on them to ensure that they are feeling safe and they are feeling heard and they know they have been seen too.
Thank you so much, Sarah-Jayne. Sammie, how would you respond?
Thanks. So firstly, there are three things to consider here, aren't there? Let's firstly acknowledge that SARS-2 can organically cause mental health changes in children and young people, and that children with mental health symptoms need support, not just ignoring, dismissing, and being told they need to go on a waiting list. They are likely to have physical symptoms in addition to these mental health changes, and they must not be ignored. And then secondly, any adult or child learning to manage new long-term illness that may also include life-altering disability that's completely turned their life upside down is likely to have some effect on their mental health. And we really need to recognise that. It's been a huge change for the families that come to us from where they were to how their lives are now. It's been a huge change. And lastly, we need to recognise the impact of the poor experiences families are having. What language has been used around children and young people when they've been attending appointments? Is their voice being heard? What challenges are the children watching their caregivers face? And what impact is that having on the wider family unit, siblings, the extended family members, as well as their friends, their peers, their school life? What level of gaslighting has a child experienced before they've even been able to get in front of someone who's willing to listen? And I think we really have to look at all of these points and consider them when we're looking at the child and the family unit and how they're functioning and how they're being supported, because they can ripple through a family and tear holes, and we need to be mindful. We need to use appropriate language and we need to take a holistic approach. Thanks.
Thank you, Sammie. Binita, what do you have to say about this mental health issue?
Yeah, I think Sammie's made the points I would make about we just need to be really mindful that millions of children haven't suddenly become mentally ill after having a novel virus, that neuroinflammation will be playing a big part in this. And actually, the one thing that has very clearly come out of the large survey type studies is that mental health is no worse in children with long COVID than it is in the wider children's population. So I think it's really important not to associate long COVID with mental health issues per se, but understand that, of course, there is a reactionary issue with suddenly becoming very disabled and not being able to live your life as you know it. I think I had completely under-recognized my own daughter's neuropsychiatric symptoms. Her behavior did change. She developed obsessive compulsive behavior, mood swings, became very oppositional, and I hadn't really put it down to the illness as such. But all of that has melted away as she's got better and had that inflammation treated. So I think psychological support's really important. Of course it is, but it needs to be part of that bigger holistic service rather than seen as the cure for symptoms.
Thank you so much. Eleni, do you have some comments related to this?
Yeah, I mean, it was great to hear from all of you. And the only thing that I could add in is that if long COVID does not exist in the country, then mental health diagnosis is the only way to have educational rights. So this is happening at my country at the time as we speak, since there is no ICD for long COVID and there is ICD for mental health disease, then children are getting this diagnosis to have educational rights. Otherwise, they're going to miss school. So we need for long COVID to be legitimatized in all over the world.
Yeah, thanks, Eleni, for pointing out those disparities between situations in different countries. Does anyone else have a comment to add related to the mental health topic or another topic? Kirsty?
Yeah, I'd like to just pick up. Sarah-Jayne mentioned sort of parents, and unfortunately, the mental health of parents has come into question in some situations as well, and that causes additional strain on a family dynamic, and it's parents that are pushing for the treatment for their children. They're the ones that are fighting, whereas it should be us as healthcare professionals that are actually doing that. And not sort of just saying, oh, it's your anxiety that is causing your child to be ill, because there's so much evidence to the contrary.
Thank you for saying that. And Cara, you had something?
Hi, I just was scanning the chat, looking to see if there was any questions. And there's a question about, does anybody have any experience working with children who have POTS? Binita and Sammie, I don't know if you can speak personally. I think they'd probably prefer to hear a personal experience rather than a physio experience.
Yeah, so my daughter didn't have POTS. I'm not a paediatrician, but I do know plenty of children through the long COVID kids group who do have POTS and have really, really struggled, A, to get it diagnosed, but B, to get appropriate help, and often having to go to see private adult physicians to get the help they need. But there are plenty of practical things that can be done to help with POTS. Some of we've heard about, and I won't talk about the physio aspects of things, but treatment with beta blockers, increasing fluid and salt intake, wearing compression garments like stockings and abdominal pressure, which is difficult for kids, but I know kids who do wear them. It's taking care about what activities you're doing to prevent those sort of falls. But I think ultimately we've got to treat the underlying cause. And I keep banging on about this, but that the underlying cause is likely to be the autonomic neuropathies. That's the disease of the nervous system, either caused by persistent virus, or it's caused by blood clotting and problems with the blood supply to the nerves, or it could be some sort of autoimmune, the body attacking itself that's being triggered by the virus. There are other drugs as well, other than beta blockers. There's things like midodrine and fludrocortisone that can be given to children as well, as far as I'm aware. So it's finding the right specialist. I think that's the most important thing. But there's plenty of advice, and the POTS UK website is very good as well for getting information from.
Thanks so much, Binita. I'd like to just close by saying thank you so much for sharing your personal stories and experiences and expertise. It's been wonderful. For me, there are a couple of really important takeaways, in particular related to young people with COVID. And that's first, similarly to the adults with COVID, do not give up. Keep looking for solutions and people who will listen to you. The parents out there, try to advocate as best you can for yourselves. Keep pushing until you get the attention that you and your child need. To the healthcare providers out there, keep this team approach in mind and have the ability, humility and willingness to listen to and believe the young people and their families who come to you for looking for help. And finally, just a comment to the researchers, please don't forget about this population of people when you're doing your research. So thank you very much. It's been a great session.